Hello everybody, today we are going to do a little talk on symptoms of hay fever, how to treat in children. Hay fever is an allergy to pollen and a fine powder that is released from the plant during the spring and summer months and affects around 20% of the people in the Britain. And tree pollen is between late March to mid-May. Then grass pollen, that is between mid-May to July, and wet pollen between the end of the June to September. I think this time we are seeing the wet pollen at that point. Okay, so now while it's uncommon in children under 5, it can become a problem in some of the summer months. Your child is more likely to suffer from hay fever if other close members are affected. There are signs to look out for and what to do if your little one is prone to allergy. Symptoms are, sneezing, runny nose, red, itchy, watery eyes. Key pointers to hay fever will be: symptoms occurs during the pollen season, which is normally between March to September. Symptoms tends to worse on days that are warm and sunny, and the most severe first thing in the morning and in the evening. And hay fever is distinguishable from common cold as there is no fever and it can last for several weeks. How to prevent it? Now, take note that pollen count and keep your little one inside. If it is very high pollen count, you can see the weather notifications, and if it is particularly windy, that is very important. Invest in pair of wrap around sunglasses to stop pollen entering the toddler's eye. Keep the car window shut while driving. Smear petroleum jelly around inside your nose of child to trap the pollen and stop being inhaled. Wash her hair and face and hand when she become indoor and comes back in indoor, and change her cloth and take shoes off when you come inside. Avoid drying her clothes outside as the pollen can cling to them. Pets can also bring pollen with the fur, so it is best to wipe them down with a damp towel when they come from outside and bath them. And of course, it is better to bath them regularly too. Use the air conditioner in the home rather than opening the windows. What are the treatment? So wipe the eyes with cotton wool and cool water to soothe the symptoms. Consult the pharmacist, who will be able to advise you about any over-the-counter medicine which might help. Nasal saline drops or a spray can be used to rinse the pollen from the nostril or clear the blocked nose. And steroid nasal spray and sodium chromoglycate eye drop can be prescribed for child with severe syndrome from age of 6 years. So in this way you can protect your child from pollens and hay fever. So thank you for listening and hope it helps, and enjoy the summer without hay fever. Bye bye for today. We'll discuss another topic next time.